we have to talk about malaria because tomorrow is World Malaria Day. It's got a great theme, and we have Dr. Kezia Malm, is a program manager for the National Malaria Control Program. She's here to talk to us a bit about the day in itself. Good morning to you, Dr. Malm.
Good morning.
Yeah, and what's the theme for the year, for this year particularly?
Ready to beat malaria.
Have we been doing well? Always ready to beat malaria as a country?
We have, and we really need to be ready to beat malaria. We've come this far. If you look at our progress in the country, I think if we put in more effort, we'll be able to beat malaria. Okay,
you guys are always using these phrases, disease burden, epidemiology and all that. What's the current rates averagely at OPDs across Ghana?
Okay, so in 2017, we recorded about 32% of our outpatient attendance due to malaria, and that is a reduction over the years. You know, we talk about the 40%. Burden is still high, but over the years, we've seen some reductions.
Okay, now just reading some literature, we're told that Africa will account for about 470,000 beds averagely. Nigeria accounts for 24%, so to speak. But in Latin America or South America, only 650 people died from malaria last year. And I'm thinking that less people would die from it, even maybe 2 or 3 would die from it in Ghana, I think.
Unfortunately, that's not the situation. So, like you rightly said, Africa accounts for about 470,000 of the death, and that is around 95% of the burden in the world. So in terms of disease, in terms of death, Africa is highest. And unfortunately or fortunately, Ghana falls within Africa. So last year, we recorded around 600 deaths in our health facilities.
Across Ghana?
Across Ghana.
And many of them centered around which sections of the country?
We see the highest numbers coming from Northern region.
Why?
Before I go to the why, I must say that even though the 600 is high, it's a great improvement over the years.
Oh, it's still an improvement?
A great improvement. Yes, the number is high. So Northern region, what we realize is that most of the people come in late when they have malaria, and they come with a lot of anemia. So by the time they get to the facilities, it's too late to help them. And even what we recorded last year has been a lot of improvement. We work with the region and the health facilities to try and get people into the health facilities early enough when they have malaria so they can be treated. Because the medicines used for malaria, they do work. They do work very well. So once you get it and you get treated, you should be cured.
Okay, so at the National Malaria Control Program, that's the whole strategy. You make sure that you do what?
We focus both on preventing people from getting malaria, and on those who are unfortunate to get malaria, we ensure that they are given prompt and effective treatment. So that's what we do. In terms of prevention, I'm sure you've heard about the ITNs. That's what is most common, the nets. We promote the use of the nets, and we also promote the use of indoor residual spraying in some parts of the country where the walls of the rooms are sprayed with insecticides, and then when the mosquitoes goes to rest on it, they imbibe the insecticides and they die. For pregnant women, we also promote intermittent preventive treatment, where when they get pregnant, usually after the first 3 months, we start this medication that we give to them once every month till they deliver. It protects them and it protects their unborn child. About 3 or so years ago, we started another intervention in the northern part of the country, Upper West and Upper East, because they are high burden and their malaria is very seasonal. And that intervention was for children under 5, where we give them a medication once a month during the high transmission season, just to break the transmission. And so those are what we do for prevention. And I already talked about the management, where we ensure that we test before we treat, and we try and get people to hospitals as quickly as possible for prompt treatment.
Well, awesome. So like a day like tomorrow, which is the day when the world is marking malaria, you usually would have a formal event, or how do you mark it?
Yes, so this year what we are going to do is do an outreach service at the Sherman Market. So what we are going to, not just, it's mainly World Malaria Day, but we want to use the opportunity to reach more people, to send a message of getting people to sleep under their nets, getting the pregnant women to go to antenatal clinic early enough and start their medication, and also treat anybody that we detect to have malaria. So we'll have an outreach service at the Shaman Market tomorrow. We'll have our partners working with us, and we'll still add a few of the non-communicable disease screening just to be able to reach people.
Any particular reason why you chose Ashama, or because it's a congested area?
We chose Ashaman because we thought that was a site that we could reach people enough within the shortest possible time.
Well, wish you all the best for the day. We know that you have to go to Adom TV, to our sister station. But you'll be here on Thursday, or one of you will be here on Thursday, definitely. And we'll be opening the phone lines within that period so that you, our regular viewers, would also contribute through the regular phone lines we have and the various social media platforms as you ask questions about perhaps issues of prevention and treatment of malaria, if especially you're in some of those endemic areas like in the northern region and elsewhere in the northern part of our country, and you can reach the clinics and the health facility as quickly as possible. You also bring in your experience. Let us know what you think, and that definitely will be on Thursday. But we've had in the studio Dr. Malm. She is the program manager for the National Malaria Control Program. It's been a privilege to speak to her. Good morning to you as well, and thanks for passing through. We know that we'll have you on Thursday, but as always, please get an interactive Facebook JoyNews on TV. We also have an interactive handle on Twitter, and you're always going to watch us live through our regular channel on YouTube, My Online TV. We have to take a break. When we come back, we'll have a lot more for you. Stay on.